This is Michael with ISA. President Osili, just want to do a quick sound check. I didn't hear you if you made a comment. Please do another sound check. President Osili, could we do a quick sound check with your device?
For instance,
all right. Can you hear me all right now, Mr. Lamar?
Thank you, President Osili. Loud and clear.
Very good. Thank you so much.
Mr. President, how you doing?
Master, how are you? I'm excellent.
I'm fantastic.
It's a great day.
You staying safe and healthy?
We are trying. We are learning to love being together as a family. It is it's an amazing time.
I'm glad to hear that.
Yes. How are you?
I'm doing. I'm telling people I'm working harder now than I was, which is really interesting. Not being on site all the time, but
yeah,
I'm good though. I'm good.
Do you find this maybe slightly more productive because of there's less travel time?
I don't know if it's more productive. I still think it's something to the dynamic of being I read a lot of body language and stuff like that, you know. So we have accomplished a lot. Like, I still like the hugging and the kissing and the touching and the greeting and the meeting.
Understood.
So we've gotten a lot done.
That's beautiful. All right. Excellent.
Pastor, don't be hugging and kissing and touching and loving on anybody.
Mr. Mayor, how are you?
Good. Mr. President, how are you doing today?
I am great. How are you doing?
Good.
Good. All right.
Dr. Kane, as soon as you're ready to kick things off, we are ready to go.
Now, does that help? Can you hear me?
We can hear you, Dr. Kane.
You can hear me?
Yep.
Now, when I hit the mute button, the video picture left. Guys, sorry.
Okay, Dr. Kane, so you're unmuted. We can see that. We just got the video, which should be next to the unmute button on your screen to the right of it.
There's just a circle that has a camera in it.
Yes, but I'm trying to tell you, when the microphone came on, the video picture went off. Let me see, participants button, question mark, and an X to leave it, but the video icon, well, let me see if I go this way. The video left icon.
Michael,
Wow.
do you have any insight to help Dr. Kane?
This is Michael with ISA.
The video button disappeared when the mute microphone came on. So if I unclick I'm going to unclick the mute button.
Okay.
The video picture didn't come on my screen.
Dr. Kane, this is Michael with ISA. If we can allow for a moment, I recommend checking the video settings in your WebEx client. There should be an options button with 3 dots.
Does it say set up on the side?
There's a more options button in the toolbar at the bottom of the screen. And when clicking on that more options button, there is...
You see it?
Dr. Kane, I do not see video at this time.
I don't see the option buttons that you're talking about. Down at the bottom of my screen are all the panel participants. At the bottom of my screen.
Dr. Kane, since we can hear you loud and clear, why don't you go ahead and start? And then
Okay.
if we need to set up one-on-ones afterwards, we can do that.
I think that'll be fine. Okay, thank you. Okay, all right. Good morning, everyone. I am Dr. Virginia Kane, Director and Chief Medical Officer of the Marion County Public Health Department, along with some community leaders in Mayor Hudstead and some other key folks that will come on the program. You know, for a long time, we've recently seen in the national media that African Americans and other vulnerable populations are disproportionately impacting our COVID-19 cases. And we recently were able to look at our data to confirm that our African American residents have been 3 times more likely than white residents to get diagnosed with a confirmed case, although we only make up 30% of our population, with our Latinos making up 11% and our white residents making up 56% of our populations. Our data also show that our African Americans were 2.5 times more likely to be hospitalized with our COVID-19, and unfortunately, twice the deaths compared to our white residents. And we know that some of the risk factors are chronic health conditions associated with our population, such as heart disease, asthma, hypertension, diabetes, obesity, and asthma, that puts us at higher risk for complications for COVID-19 infection. And whether you're in New York City, Miami, New Orleans, Detroit, Chicago, we're seeing this national trend of different racial and ethnic populations being more vulnerable to this COVID-19 pandemic. And I just want to applaud Mary Jo Hotsett, who we have been aggressively looking for how to find additional testing, along with our President of City Council, Vop Osili. And let me just say, having these additional testings will help for us to recognize the extent of the epidemic of COVID-19 in our populations, like the elderly, or individuals who may be immunocompromised, like people with cancer treatment or HIV infections. And so how do we reach out to make sure that that testing is available to those individuals? And I'm happy to announce today that we will have our first community COVID-19 testing taking place in our community. And I have just a few people that I really want to thank for making this happen. We have had a tremendous number of our ministers and pastors in these communities that have reached out to me repeatedly. Reverend Moore, for example, with the Indianapolis Black Ministerial Alliance, Reverend Green from Concerned Clergy, folks from Faith in Indiana are constantly looking to see what could we do to identify this. And then especially our city council members under the leadership of Bob Osili has done a tremendous outreach in trying to figure out ways how to do this. Our Indiana Black Legislative Caucus, who have really been pushing this effort and trying to find locations where we could provide the COVID-19 testing. It was not until 2 weeks ago that we were able to have our first COVID testing that was even available to the Marion County Public Health Department. And we've been looking for over 2 months trying to find additional testing. And I have to give kudos first to Dr. Aaron Ermo and Dr. Jim Williams from the Indiana University Infectious Disease Division Laboratory, who provided our first COVID-19 test. And that's how we were able to open up our Indiana State Fairgrounds in collaboration with the City of Indianapolis and Mesh Coalition under Jennifer Pitcher and just a whole host of different agency folks with EMT, fire department, a lot of our first responders, our law enforcement with the sheriffs, IMPD, just a tremendous amount of support. I can't mention all of them to get that started. And so I'm happy to announce we have identified in our largest hotspot in Marion County. This is our largest hotspot of the most number of COVID cases that appears to be in a predominantly African-American community, white as well as Hispanic, that we have selected Eastern Star to be our first location where we're doing the testing. And we're going to kick that off next week. I do want to also thank and make another announcement that this site will predominantly, we're initially looking for individuals who are symptomatic in our community, having symptoms of maybe fever, cough, or shortness of breath. But we also want to reach out to our elderly, whether you have symptoms or not, or if you're immunocompromised in some fashion. We want to make those sites and testing available to you. We're hoping within the next 30 days that we will have at least a minimum of 3 different sites besides our Indiana State Fairground in different parts of our city in order to make it easy for people to be tested. And these are individuals we will have a combination of a drive-through process, but also another process for those who are able to walk. We're on a bus line. You can walk and be able to get your testing at this new site. And kudos to Dr. Parveen Chanda and Miss Jackie Baker from the IU Health Pathology Laboratory Services Department for bringing these additional COVID testing for us in order to expand our testing out in the community. And we hope to reach over 1,000, up to 3,000 a week eventually, providing that testing throughout our city easily. And we hope to have good hours where some days we will be able to do our testing from 10 to 6 p.m. and 2 days out of the week we will provide testing from 1 to 7 p.m. In order to try to accommodate individuals in terms of the testing. And so, Mayor, I hope you don't mind this, but I have to say your emissary, Paul Babcock, Director of the Office of Public Health and Safety, has been with us and has been working on this project with us day and night. Now, I don't know about you, but he calls me up to midnight at night trying to see where our progress is. So I don't know if you set a bad example for him, but I can tell you it's been killing me. But let me just say, you've got some talented folks on your staff that we really appreciate and have helped to identify resources a lot of times when we can have it available. And so I just want to applaud you for your leadership, Mayor, in making this happen for our community. And so I just appreciate that. I also appreciate my board of directors for Health and Hospital Corporation under Joyce Rogers, who is our chair, and our other members of the board in order to help give us the resources that we need in order to make this happen. So without further ado, Mayor, I am now able to say, and my community partners, and I couldn't mention everybody, but you know who you are. You've just been tremendous. Our Black policy leaders, from our city council folks who have helped us tremendously with this. But I really have to applaud the faith-based communities who have stepped up to the plate trying to get this message out and helping us to really push this agenda. Thank you, Mayor Hotsett, for all the work and leadership that you do. And thank you, Mr. Rob Astley, for all that you do in City Council for making this a safe community for us, but also knowing where to place our resources for the people who need it the most. And so without further ado, I'd like to introduce, who needs no introduction, of course, Mayor Joe Hotsett. You do so much for us. We can't thank you enough.
Well, thank you, Dr. Kane, and for your leadership of our Marion County Public Health Department. We couldn't have a better leader in you, and I want to express my deep appreciation. These are tough times, but tough leaders come to the surface, and you're the toughest among them. So thank you. I want to welcome everybody to the call this morning. Good morning. Today's announcement, articulated by Dr. Kane, of our expansion of testing is certainly a welcome one for the Indianapolis and the Marion County community. Increased testing is not only going to help avoid one of the worst health crises that we've ever faced, but it will allow us greater security as we begin thinking about returning to daily life amidst COVID-19. On Monday, Dr. Kane and the Marion County Public Health Department revealed that, like our nation as a whole, minority residents in our city are suffering a disproportionate share of the worst consequences of COVID-19. Frequently, some members of at-risk populations are at risk because our community relies on them for essential services throughout the course of the pandemic. Employees at grocery stores, as an example, warehouses, delivery services, gas stations, and many more. Without the men and the women who work in these jobs, this strange time would be far worse than it already is. In addition, with increased testing among people disproportionately affected, Indianapolis and Marion County can also get an even clearer picture of this virus and its spread. That information will be incredibly valuable for everyone in our city. Not only can it help prevent future infection, but a clearer picture, a more accurate picture, will begin the process by which we return to a more normal daily life. So let me add what Dr. Kane has already said. My sincere thanks to the Indiana Black Legislative Caucus and other of our city's representatives for their passionate advocacy surrounding this issue. I believe that City County Councilor Keith Graves and State Representatives Greg Porter and Robin Shackelford are on the call today. I certainly thank those three in particular, but the entire Black Legislative Caucus, as well as the members of the City County Council, led by our president, Bob Osley. And additionally, once again, my thanks to Dr. Kane and the Marion County Public Health Department for the amazing job they've done under tremendously stressful and difficult circumstances, as well as my thanks to IU Health for providing testing support and Eli Lilly for being a great early asset for increased testing among essential personnel. Reopening the city of Indianapolis will depend on many efforts aimed at testing, treating, and tracing this virus. No one solution will do it all, but today's announcement brings us even closer to that return. So it is in that spirit that I'm pleased to introduce my dear friend and a leading light in our community, Pastor Jeffrey Johnson of Eastern Star Church. Pastor?
Thank you, Mr. Mayor, and I'm honored to be here as a part of this. I have to admit, as Dr. Kane was talking about the different ministers and pastors, that there's been a lot of prayer going on. I believe in the power of prayer, and we've gone and we spoke to each other every day as ministers and pastors and social justice leaders about these inequities that we find in our community, because our prayer was we need equal testing and equal remedy. And we can't have equal remedy if we don't have equal testing. And so I also believe that when we pray, that we're not really praying unless we're willing to be a part of the answer to the prayer. So I'm honored and thankful to be able to partner with the city of Indianapolis and Mayor Joe Hassett, who we communicate constantly for the betterment of Indianapolis and our communities. And even to partner at this time, I believe that is a significant move. And of course, to the president of the City County Council, Bob Opsley, we appreciate his leadership and what he brings to the table. And my good friend, Dr. Virginia Kane, who I have spoken to constantly through the crisis that we're in to get the insight that we need to try to accomplish this. So for us to partner is a great honor, and I'm grateful to God and to all the participants and to everybody who is working hard behind the scene to help make it happen. And for Eastern Star Church to be in Arlington Woods, in that area that Dr. Kane talked about, with the greater risk of complications. And so many of those persons in that community are members of our church and a part of our church. But even more than that, our church is a part of that community. And that's why we started the ROCK initiative, Renewing Our Community for the Kingdom, to address issues that would be a betterment for this community. And so we know this greater risk of complications that come from economics or healthcare, or the lack thereof, or the lack of insurance, or when we hear persons telling us that you have to have a doctor to recommend you to go and get the test. And so many people in this area, they don't have doctors. And so in these pre-existing conditions, and then the lack of transportation. So to now know that we're going to have a testing site at the Eastern Star Church at our main location on East 30th Street in Arlington Woods, where if you can drive up, then drive up. If you need to catch that bus, it stops right in front of our church. And of course, Dr. King has spoken of you can drive through to get your test, but now we're designed it so you can walk up and get the test. So we're very, very excited that this community is not being overlooked. When we look at the national narrative that people who are Black and brown are being overlooked, and who are some of the main ones on the front line to help us to make it through this crisis and to sail through the storm. And so now to know that testing will be available to them, and that now they can come regardless of how much money I make or don't make, regardless of my gender, regardless of the color of my skin, regardless of the neighborhood that I live in, that I can go and get the same testing that other people from other socioeconomic groups are getting. So I'm honored to be a part of this. I look forward to seeing what God is going to do as we unite together. I believe, as the scriptures teach us, that one could put 1,000 to flight, but two could put 10,000 to flight. So we have so many of us who are coming together to work with this to make it happen. And I just can't wait to see the successes and the victories that come out of this. And I certainly want to thank God for our church council at the Eastern Star Church and our staff and so many volunteers, even now through this crisis, that have worked so hard. And now we get a chance to come alongside the city of Indianapolis and Mayor Joe Hogsett, as well as Marion County Health Department and Dr. Virginia Kane. So we're honored to be a part of it and look forward to helping at the very highest level that we possibly can. And so now I want to present Bob Opsley, who we thank God is doing a wonderful job leading the council, and we're grateful to have him with us.
Thank you, Pastor Johnson, for your commitment and your support for this endeavor. And my thanks too to Dr. Kane for her tireless efforts, and to Mayor Hogsett for his amazing leadership during this incredibly challenging time for our city. And last but not least, I want to thank all of our city's frontline workers, our healthcare providers, our doctors, our nurses, our EMTs, our first responders, and other medical staff who've battled not just this COVID-19 epidemic, but their own fatigue, their own fears, on behalf of all of us. The news over the last several days that our city, like communities across the nation, is seeing higher rates of COVID-19 infections and deaths among African American residents was sobering, but it was not altogether surprising. Just 2 months ago, a resolution co-sponsored by every single member of our City County Council acknowledged that race is too often predictive and a predictive factor for a wide variety of individual outcomes, including health. And in passing that February 24th resolution, the council unanimously called for equitable policy decisions that address that reality. So I'm gratified and grateful today to stand with our mayor, Mayor Hogsett, with Dr. Kane, and with partners like Pastor Johnson, as we undertake precisely this kind of action that we embark on today. Protecting the health and the welfare of all Indianapolis residents is the council's and the city's #1 priority. And we must address the disproportionate impact COVID-19 is having on our African American residents and work to prevent COVID-19 from widening existing health disparities. I believe that steps outlined today by Dr. Kane will help us to achieve all 3 of these goals. Tracking the demographic data of COVID-19's impact and targeting testing to those most at risk is sound science. Investing in tracking the demographic data of COVID-19's impact and targeting testing to those most at risk is sound policy. And it sets Indianapolis on a path that will help us protect our most vulnerable residents from this virus, provide healthcare access to those who need it, and in so doing so, guard against further spread of COVID-19 across our city. It also provides a model for how we as a city can make equitable policy decisions. And it gives me confidence that we will emerge from this challenge an even stronger community than we were before. So none of us yet know how this crisis ends, but one thing is certain, that we must continue to invest in a community-based, data-backed approach to testing and allocation of public health resources. An expansion of testing, especially to those in our most vulnerable populations, is our path forward. So I want to say thank you to all the speakers today for their leadership, for all those who've contributed to this effort today, for just their tremendous commitment, and just pledge that we will walk this path together and remember to take care of one another during these most incredibly challenging times. Thank you.
Thank you so much, President Osley. We are now going to open it up for questions. It looks like Russ McQuaid from Fox 59 has signed up. As a reminder for any of the other media, if you will respond in the Q&A with your name and media outlet, we will call on you for questions. Russ?
There, how about that?
There you go.
Here I am. Now, it only took me 24 hours to figure it out. Good morning to everybody. Forgive me because there were some connectivity problems during the first part of 20 minutes of this thing when I was trying to listen. However, have we talked about the logistics, number of the testing sites, locations, timetables, et cetera, et cetera?
Dr. Kane, would you be able to answer that?
Can you hear me?
Yep.
Hello. So
Hi,
our
Dr.
first,
Kane.
hello, how are you? So our first site has been selected this week. We hope to tell you and identify our second site next week, where we like to get started. And then our third site, we're hoping to be able to start that within the next 2 weeks. One thing I did forget to mention is, for all of our fast food retail business services, or anybody that does pickup in regard to our products, we're expanding our essential services to those individuals so that you can now be added to the group of individuals who are being tested at our Indiana State Fairgrounds or any of the 2 sites that we hope to have up and running no later than 10 days from now.
Wonderful. Eric Berman, WIBC. Okay, Eric, we're going to come back to you. Karen Campbell with WTHR.
Hi, just wanted Dr. Kane to confirm. I know, Dr. Kane, you had mentioned Eastern Star as being the potential or the confirmed first location. I just wanted to make sure that you were talking about Eastern Star, the one located on East 30th Street.
Yes, that is a confirmed site, and we will begin testing next Thursday of next week.
Thanks.
And that is confirmed.
Sam Quinn, IBJ.
Can you hear me?
Yep.
Okay. I also missed the first half of this press conference from connectivity issues. So can you repeat how many tests you hope to be able to do through this community testing?
Well, we will hope to do at least a minimum of 1,000 tests per week, with the goal very shortly, within 2 to 3 weeks, of doing 3,000 tests per week.
David Williams, Swish TV.
So no, so I'm glad you highlighted that. We have a lot of our members that may have no insurance, and then we think it's a major challenge for someone to try to identify a physician to just get a doctor's order. So no one will require a doctor's order to come and get tested, because that's just a tremendous barrier for our folks who are low income. And we will provide that doctor's order from our Marion County Public Health Department for individuals.
Eric is having voice issues. For Dr. Kane, how was the county able to procure tests? You've said you've been trying to procure tests. The state says it's still trying to get enough swabs. How did you solve this problem?
So we were able to contract with the Indiana University IU Health Pathology Laboratory Service Laboratory. And we were just able to get that negotiated actually last week. And we've been in constant communications with different vendors in terms of getting that, but I am pleased to say that IU Health stepped up to the plate. And again, I want to thank Mr. Parveen Chanda, who's the Chief Operating Officer for IU Health, and Ms. Jackie Baker, who's over the laboratory, to make this happen for us.
Sandra Chapman, WTHR.
Good morning. Dr. Kane, this question is for you. You mentioned that for 2 months you've been trying to get testing in Marion County. When
Yes.
were you aware that there was a great concern, and what have been the barriers to getting the type of testing that we know that the Indiana Legislative Black Caucus has been asking for, and just that as a health provider you have wanted to see?
So let me just say that at the beginning of the epidemic, you could only access tests through the Indiana State Department of Health. And my understanding is they had a limited number of kits coming to the state of Indiana. And because they were getting their kits from the Centers for Disease Control and Prevention. And what normally happens that if you're having like a big outbreak in New York City or a big outbreak like in California, CDC tries to direct as many of those tests to those areas where there are huge hotspots, and like now in Detroit, Michigan, and other cities. So we had less access for tests to get that. And then we were only able, just a little over 2 weeks ago, to get our first test. Now, our health department has a public health laboratory, and we've got great instruments costing over $10,000. But trying to get the reagents, we're told there's a back order through the country for the machine that we use in our public health laboratory, and that the first time they thought they might be able to provide reagents to us would be June the 1st. So that's been unacceptable. But I should acknowledge this. I'm on the faculty at IU School of Medicine in the Infectious Disease Division. So through those connections, I have been able to access these additional tests from the IU Health Network institution in order to get these tests. And then let's just tell you this, other tests have been available from vendors, but when it takes you 5 to maybe 7 days to get the results back, viable thing. And so when you can get your testing locally from Indianapolis, you don't have to mail your samples, out of state to get the results. So this provides us being able to get the results in a more timely fashion.
And just one quick follow-up. You mentioned the hotspot. Can you provide boundaries, street boundaries for the area that you have? I know it's 30th and I think you said Arlington, but are there four boundaries?
It is the zip code. It is the zip code with the 218 at the end of the zip code.
46218.
46218.
Okay, and one more follow-up. Pastor Johnson, since you're on there, can you tell me what your reaction is to learning that the area where your first in sanctuary has been for so many years, that this area has been hit so hard by this virus?
I'm not surprised at all. When you listen to the national narrative, our city lines up with that. It's a community that for a long time has been overlooked in terms of economic development. It's a community that has no grocery stores in it, that it's a food desert. It's a community that the average salary is $25,000 a year for a household. And when you look at just these inequities that take place, then that's what leads to these disparities that are coming up. So I'm not surprised at all. Our church has been in that community for more than 25 years. That's the reason we started the Rock Initiative, because of these kinds of disparities and seeing what kind of investments can we make in this community to bring about a change. So I'm not surprised, but I'm grateful that Dr. Virginia Kane reached out to us and asked, would we be open to it? And as soon as she asked, the answer was yes. I didn't have to call and check with anybody. The people at our church love that community, and we have worked hard to come alongside them, and we're honored to be a part of it.
Justin Mack, Indy Star.
Yeah, good morning, everyone. This question, I'm not sure the best to field it, but logistically, for the people who will be either walking, taking public transportation to these new sites, how will the walk-up testing work and differ from the drive-by testing that people have kind of become acclimated with? What protections are going to be put in place for both the people walking up and for those people administering those tests at these new sites become established?
So let me answer that question really easily. So we will be doing a significant amount of social distancing. We have a lot of greeters. We will be able to have limited people coming up to get tested. We will try to do prior registration where you can do electronically, but you also know a number of our people don't have computers, so that they can also call and do a pre-registration with our call center. And then despite all of that, you know, people will just show up. They don't know that they need to call in advance. And so we'll be able to do a tremendous amount of social distancing. Secondly, they won't have to be standing necessarily while they're waiting to get tested. We will have a great process where they can be seated, but not close to anyone that they can expose and brought up in terms of being tested for those who are walking. And we'll have different lanes for those who want to just drive through and they don't have to get out of their car.
Karen Lloyd, WTHR. Karen's question was, are tests open to anyone?
So actually, we're trying to get the people who are at the highest risk for the COVID-19. So initially now, we're just trying to get our elderly. We're trying to get anyone immunocompromised. We're trying to get the folks who are symptomatic, meaning that they usually have 2 out of the 3 risk factors, either fever, coughing a lot, or shortness of breath. And sometimes you may have GI symptoms, such as nausea, vomiting, or diarrhea. And we're also noticing that people who have recently lost their taste or smell can be a significant symptom of people who are COVID-19. And so those are the ones we're initially trying to get, but we hope to eventually offer a site. If you have no symptoms and you just want to know you're infected, we're also very concerned about we may have a significant number of individuals out there who have no symptoms, but they are infected with the COVID-19 and they can spread it to others by touching surfaces, environmental surfaces and whatever, and somebody can come behind you, touch that same surface and become infected. Because, so that's critical to us too. So we're hoping to open our 3rd site, just looking for anybody who wants to get COVID testing and they don't meet any of the other criteria for our 2nd test, so that we can just, be able to spread it out for everyone. Don't forget, anybody that works in the food industry, fast food, quick service type of thing, we want you to come out and get tested. I really want to try to get as many frontline folks tested or have the availability to do the testing. Call us if you think you are not on the list for essential services, and we will definitely make things available for you. So definitely call us.
David Williams, TV.
Yes, sir. Not at all. So all the tests and costs related to the test of the related to this that test will be under the budget of the Marion County Public Health Department. We are paying for those services, so I don't need any insurance information. We don't want to be a burden for folks. Come and get the test. Now, I may have to hit on the mayor or even city council to help me offset some of my costs. I didn't want to scare them on the first day.
Wes Mills, Inside Indiana Business.
Yes, can you hear me okay? I was shopping at Meijer over the weekend on the city's west side. I'm sorry? Okay. I was shopping at the Meijer store on the city's west side over the weekend, and I saw a large,
I lost the sound.
Yes, I'm sorry, Dr. Kane. I'm not sure if you're hearing me because I have people talking in my ear. I was shopping at the Meijer store on the city's west side over the weekend and saw a large percentage of Hispanic families that were not wearing masks. The parents, the children, perhaps even grandparents. I was surprised at the high number of people I saw not wearing masks inside the grocery store. Are there any steps being taken to be proactive to reach out to those populations and say, are you embracing the preventative measures, wearing masks, social distancing, things like that, to prevent them from having a need for the test?
Yes, so we're about to start a major campaign with our Latino population. Some of it may be issues that they can't access a face mask, even though they may want one. So we're trying to look at what resources we can bring to folks who may not have the ability to buy a face mask, but some of it can be a cultural perspective. So a lot of education will be needed in order to try to reach that population in education, especially for those who may have the ability to seek out medical care. So individuals such as Dr. Gloria King, who is director of the Hispanic Medical Services at Eskenazi Health, will be helping to provide some recommendations from the Latino community. She is the chair of the Latino Against Domestic Violence, chair of the board for that organization. Marco Dominguez, who the health department has had great partnerships with the past. He's a communicator and has been a host of Latino issues on television, who we will be reaching out related to that. And we have a number of Latino reporters that are affiliated with their stations who have a tremendous amount of outreach. So we are trying to identify those folks who have a lot of experience reaching into the Latino community. What are the best mechanisms of getting the message out? You know, what's radio stations that they may be listening to, doing special newsletters out in their communities, flyers that will convey the information to them. But it's really their leaders who they trust, who's in their community day in and day out. Our Indianapolis Latino Institute, Indiana Latino Institute, for example, does a lot of effort in terms of education, Marlene Dotson. And so a whole host of organizations we will be reaching out in order to get that message out for them. Thank you for asking, because that was a great question.
We have Russ, Eric, Darian, and Sandra, and then we're going to let these busy people get back to their jobs. Russ McQuaid, Fox 59.
So I'm wondering if Dr. Kane, and for our community leaders there, we talked about the folks who are frontline, who are essential that we get them tested. What are your concerns about both the staff and the residents inside of nursing homes in Marion County regarding either isolated areas of outbreak there or just the testing of those frontline workers in nursing homes?
So we feel really strongly about that long-term care facilities are staffed in those facilities to get tested. We know that a number of them were initially tested by the Indiana State Department of Health, but since about, I want to say at least 2 weeks now, we have our own recovery response team. So we are going into long-term care facilities and providing additional testing for staff as well as residents, and trying to concentrate on those individuals who are not only symptomatic, but individuals that are asymptomatic. Because a lot of people are not aware that our initial recommendations from the Centers for Disease Control were not optimal. And as a result, people were only testing just the folks who were symptomatic. We now realize there's a significant number of patients who have no symptoms whatsoever, but they could spread the disease. So it is long been our policy at Marion County Public Health Department that we need to test long-term care residents who have no symptoms whatsoever. And we've been doing that process now for at least 2 weeks in our long-term care facilities.
Eric Berman from WIBC has a follow-up question. How many cases in 46218 and how does that compare to the rest of Marion County?
So I can't honestly tell you just exactly the number of cases in that particular zip code because unfortunately it was my epidemiology team under the direction of Dr. Joe Gibson who was able to identify that as a hotspot. We can provide you that information later for you, but I just don't have it exactly at this moment.
That's great. Darian, Indiana Public Broadcasting.
Can you hear me? Okay. Thank you. Besides increased testing, are there other things being worked on? Are there other things in the works to address the COVID-19 health disparities? Dr. Kane, you just mentioned.
Thank you. So actually, yes, there is. So look next week and you may have another announcement addressing the other initiatives that we're going to be doing, providing more resources to areas that may be impoverished and areas where other resources may be needed from a vulnerable population standpoint for people who are at high risk. So we may be kicking off 2 initiatives. I don't know if both will be announced next week, but look for that.
And our last question is Sandra Chapman from WTHR.
This question is for the mayor and for our council president. In light of these disparities and all of the talk from state level about trying to open back up the city, the state, getting people back to work, are you, either of you, in a position that you're able to provide some guidance to the state as to Indianapolis, Marion County, and how critical this time is right now to get some of these vulnerable populations tested and treated?
Mr. President, do you mind if I take a crack at that? Yeah, Sandra, the truth is we've been working very closely with the Indiana Department of Health, Dr. Box, and the governor. I've been very impressed, frankly, with the cooperative and the collaborative approach that the state and the city have taken in working together. Now, in direct answer to your question, of course, our stay-at-home order issued by Dr. Kane and certainly supported by The administration expires, I guess it would be a week from tomorrow, May 1. There have been no decisions made, at least as far as I know, by the state or by the city yet as to where we go from next Friday. I will tell you, though, that when I talk to business leaders and community leaders throughout the greater Indianapolis area, there are real concerns about getting back to normal too quickly. We want to be responsible. We want to be responsive. We know how disruptive this period has been. And people naturally become impatient. But it would be extraordinarily dangerous, in my opinion, if we made the mistake of essentially trying to return to a complete sense of normalcy too quickly, running the risks that are associated with re-implementing or reinstituting the virus, maybe even more aggressively than we have experienced it. We do know that as disruptive as these restrictions have been, we do know that they are working. And so we need to take the time that is necessary to make sure that they are as effective and that when we do return the city and the state and alleviate some of the restrictions, that we're doing so in a responsible way. Mr. President, you want to add to that?
Sure. My thought is that we, just as you're saying right now, need to be looking at this thing in terms of the long term, not just this short term, and step by step observing our progress and measuring it against the risk that we find. Doing something incredibly prematurely, I think will have an amazingly detrimental impact on our city. And I just want us to be as cautious as possible, even with the pressure and the disappointment and the frustration, that we mitigate this, that we identify where our challenges are, that we try to control where we see these outbreaks and where we see these surges, before we take a giant leap that we'll then have to return back to isolation. It's an incredibly frustrating time, I know, for so many of us, but we have to think about the long term. And I think that most of our city leaders feel this way as well, understanding the challenges and the frustration that goes with this period.
Wonderful. Thank you all for joining us today. A press release will be going out here in a few minutes, and a recording of this press conference will go out later this afternoon. Thanks so much.
Thank you.
Thank you. Thank you.